I'm Dr. Stephen Pearlman. I'm dual board certified in facial plastic and reconstructive surgery, director of Pearlman Aesthetic Surgery, and past president of the American Academy of Facial Plastic and Reconstructive Surgery. We'll be discussing revision rhinoplasty start to finish, Rhinoplasty has the highest incidence of any operation in cosmetic surgery that requires revision. One of my specialties is revision rhinoplasty. I lecture around the world in revision rhinoplasty. What we do is we take patients who had prior surgery, who've had either poor results because it doesn't look good, or have difficulty breathing, and restore them. Most commonly in revision rhinoplasty, to restore both form and function, we need to build up the nose. It may look smaller, but we need structure and strength. We do that by using cartilage grafts. My preference is the patient's own cartilage. The best source is their own septum, which you often remove as a part of a devious septum. However, if they had prior surgery, they may have had septal cartilage used and may not be available. Other options are ear cartilage. The problem with ear cartilage, it's soft and mushy. It's thick, it does not mold well. So the last option is using rib cartilage. You can use the patient's own rib or donor rib. You can even feel there after surgery 6 months later, you'll be hard pressed to find where the rib was removed from. What this does, it gives us a nice piece of rib, your own natural live rib, that we make into small slices. We put it back in to restore the nose so you can breathe better and look better.
So in revision rhinoplasty, patients have been through past traumas. We have patients who've had one previous rhinoplasty all the way up to 4 or 5 previous rhinoplasties. So they've been through traumatic experiences. They did not get the result that they had expected. And I sort of equate it to having PTSD from something. And it takes a lot for a patient to go right back into another surgery, expecting different results again. And people are very timid, they're apprehensive, they may not trust physicians anymore, and it's really difficult for patients to get through this process. So part of my role in the practice is to really be hands-on and guide patients through the surgical process. So revision rhinoplasty patients are very different from regular rhinoplasty patients because they've been through something, they've been through an emotional trauma, and they need more support, which is why I have become a secondary therapist to a lot of these patients. And I love doing that because it's such a wonderful opportunity for me to provide an empathetic, sympathetic ear and just like someone to lean on through that process.
I hope you found this video on revision rhinoplasty informative. If you would like more information, go to our website, mdface.com. We have some great before and afters. Email us at info@mdface.com or give us a call, 212-223-8300.